to share my story of anterior repair surgery. 3 years ago when I had it at the time, I didn't vlog it along the way, like the day I went into hospital, and then I think I vlogged a few days later, and then I think I vlogged kind of after that. But looking back at the videos now, I literally spent that whole month drugged up. I was on so many painkillers. If you are having anterior repair surgery or posterior repair surgery, then the videos are really interesting, so do go and look them up on YouTube. I'll put all the links below. But yeah, just be aware that I am kind of out of it. Today I just wanted to share my experience with you, and I think I just wanted it to the fact that if you're going to have a surgery like this is a really big surgery. You need to be prepared both mentally and physically for that, and I'm just going to share my tips and my advice about my surgery and whether or not it actually worked. Watching the video back from the day that I actually had my surgery, at the time I was really honest with what I vlogged, and I was really honest about how I felt. But I think because I was so out of it, like, it was a new experience for me. I'd never had anything done like that before, obviously apart from giving birth. My story is, from a young age, from the age of about 21, I had endometriosis. I had removed by laser surgery. It was fine. I remember after having that surgery, I was absolutely great. My periods went back to normal. I reached the age of about 31 when I fell pregnant. And so before that, I was always really healthy. I always exercised. My bowels were never too regular, but that was okay. I ate a healthy diet. I was always at the gym. I was always running. I was always swimming. So that was great. I fell pregnant. I didn't have a great pregnancy. I didn't suffer any morning sickness. I did suffer with a lot of discomfort in my tummy area, a ton of back pain. At the same time, I still carried on exercising during my pregnancy, but just like exercise, it was mostly swimming. My daughter was then born by a forceps delivery. She was lovely and healthy. She was a really good size. After I had my daughter, that's when the complications began. It cost me a lot of money to get to the root of my problems. So it was time to head home with the baby and give myself some time to recover. That I couldn't go to the toilet properly, and it got to the point where I would have to say to my husband, like, every evening, I need you to have the baby for an hour and a half, just so I can go and try and sit on the toilet and go to the toilet. And I just could not go. And at the same time, I was having quite a lot of pain. I was having a lot of stretching pain. Well, because I just thought, look, my body's just been through a whole load of trauma, and this must be normal. This must just be a recovery after birth. 6 months down the line, my toilet habits still hadn't improved, and I kind of felt like I spent my days like I was this new mum. I was really happy, but I felt like I wasn't physically fit, if that makes sense. I kind of get into that routine of just feeling physically healthy, even though I was, taking exercise really gently. I was eating really well. I was drinking gallons and gallons of water. Nothing was helping me. My periods were out of sync. Just nothing was going back to normal. I did that. It was time for me to do something about it. I decided, I did visit my regular doctor, and I did have lots of examinations and stuff, and they thought maybe it was endometriosis or something to do with that. And it turned out that it wasn't, and after lots of tests, I decided to pay privately to see a private doctor at a private hospital. After a few tests and a lot of money, the doctor told me that I would need some surgery for a posterior repair. I was willing to do anything to get back into that routine of just going to the toilet normally and having a normal period and to stop this pain. So I paid for MRI scans, I paid for tests to make me pee, I paid for tests to see how quick I could pee, I paid for tests to see how long I could hold my pee in, I paid for x-rays, I paid for scans, I paid for consultations. This private doctor, and I think he realised I had spent a lot of money, and this was over a time frame of 6 to 8 months. It was quite a long time that it took to get myself sorted. So basically, by the time I actually had the surgery, my daughter was 3 years old. You see, it took 3 years for me to kind of get a diagnosis. This bill was racking up and racking up. So the private doctor said to me that I could save myself some money by booking in with a surgeon on the NHS to have this treatment done. This, he said, like the surgeon was his friend and he knew the surgeon and he trusted this surgeon, and if I wanted to do it that way I could have it done a lot quicker rather than waiting on his waiting list and waiting another few months. At the time this was happening, and I didn't take it into consideration then, and looking back now I really wish I had have done, at the time that this operation popped up and that slot became available for me to go and have the operation done, we had just moved house. My daughter was 3 years old, so she had moved from her regular preschool and she was about to start a new one in a different area. We didn't know anyone, we didn't really have any help. Life was really stressful. But me being me, decided no, I want to get it done, I want to rush into things, I just want to get better, and I just want to carry on being a mum to my 3-year-old. The day I went in for the surgery on the NHS at Watford Hospital, I was greeted by a nurse and I went for like pre-op assessment with her, and she did lots of questions with me. She took my blood pressure. She was really lovely, really friendly. But the one thing I did say morning that I went in was that I hadn't been to the toilet. I hadn't emptied my bowels for probably almost a week. That's how bad it was, guys. It wasn't like every 2 or 3 days. It was like more than a week. I couldn't empty my bowels for sometimes 8, 9, 10 days at a time. I tried laxatives, I tried everything, but because I had like a slow digestive tract, none of that worked and it made it a lot worse. The reason why I know I've got a slow digestive tract is because I paid for that test and that was the results from that. That is some advice. Never ever go ahead with an operation on your stomach, your bowel, if your bowels are full and you know you haven't been to the toilet properly. It was all fine, she'd had it in my notes, great. The surgeon was running a few hours late and I didn't get to meet him. The only guy I got to meet was the anaesthetist. He'd come to me and he'd said, look, I'm really sorry, surgeon's running late, relax, there's a hospital bed, here's your gown, and we'll call you when we're ready. 3 or 4 hours later, I believe it was, they called me and I went in to not the actual operating theatre, but just this little room where the anaesthetist puts the injection in you to put you to sleep. The anaesthetist was great, and I'm pretty sure I mentioned to him that I also hadn't emptied my bowels and I was a bit worried about it. There's a reason I'm here in the first place, because I can't go to the toilet. Everyone's telling me I need a posterior repair. I was put to sleep and I woke up after the operation. At this point I still hadn't met the surgeon. And that should have been alarm bells right there. Why on earth would you go into surgery without meeting your surgeon? Why did I do that? The hospital on my own. All I wanted to do was have the operation, recover and get home, rest and recover at home with my family. So I've worked in theatres and I know that by the time you get to that last patient at the end of the day, you are exhausted. I didn't want to be the last patient on their list, and I think I probably was the second from last or something. I woke up, felt really grotty. I kind of remember, the nurses were checking on me. I was so drugged up. I remember asking for more pain relief and I had more pain relief. I went to sleep that night. I had to stay in. Overnight because the surgeon had been running so late. I'd spoken to him. All I knew is that my surgery went well and it was all done. In quite good form. I think I was just so out of it and drugged up. I didn't really feel any pain at that point. Next morning was when the shit really hit the fan. I woke up in so much pain. I was told to go and have a shower and do my teeth and take my toiletries with me. I tried to get up, couldn't walk. I felt like I was in back labour all over again. I felt like I was going to give birth, but I wasn't even pregnant and I wasn't even getting a baby at the end of it. I was just in excruciating pain, and it was like a lot of nerve pain. I could not walk. I literally couldn't walk. I remember the nurse walking me to the bathroom, and then I went into the shower cubicle with my wash bag, and I was having a shower, but I had to just spend the whole time bent over, and I was like holding on to the railings and walls and anything I could. I just couldn't stand up straight. So I had my shower, had a bit of a wash, literally pulled the buzzer so that the nurse could take me back to the bed, and she sat me down and you know, helped get me dried and stuff. I have to say, throughout all of this, most of the nurses I had were all really helpful and really kind and really nice. It's time for them to take the bandaging, if you like, out of my insides, out of my vagina. Sorry to be so technical, but I think you need to know, if you're having this surgery, you need to know what to expect. So once they've had the surgery, they'll put some bandaging. They're actually called packs. They'll put the sterilised packs inside you just to soak up any blood, to help with the stitching, because you have been stitched inside your body. First nurse said, okay, we need to get the gauze out of your vagina. We need to take the bandaging out of there basically and check it and make sure it's all clean and nice, and check your stitches, make sure you're okay to go home. Still couldn't walk and I was in a lot of pain. So the first nurse came and she tried to take the bandaging out of my insides, and she couldn't grip it, she couldn't get it out. Nurse came along and tried the same thing and she couldn't get it out. Then they said to me, look, they basically said to me, not in these words, but they basically said, the gauze, the bandaging is so far, has been pushed so far up inside of you that we can't get that, we can't grab it, we can't get it with tweezers, with anything, we just can't get hold of it to put it out. And the head nurse came about an hour later, and they used a lot of saline to try and get this gauze out. Eventually they grabbed the end of this gauze, and I'm not kidding you, I swear to you, pulling it out of me, it was like a magician pulling handkerchiefs out of a hat. Like a string of handkerchiefs that go on and on and on. This gauze, the nurse was pulling. It was like the surgeon had cut a 6-foot piece of gauze, and I really wish, if I had been in a better state of mind, that I would have taken a photo. I did take a photo of my notes that the nurse had written, because even she had said she'd never seen that much gauze inside of a person before. It was impacted inside of me. So they pulled it all out, they finally got it out. It didn't make the pain any better, and for me, I feel like that gauze, that whole bundle of gauze was pushing against maybe the nerves in my back or at the bottom of my spine, which made me feel like I was having a back labour all over again. I had to stay in hospital for a few more hours, have some tests. The physio had to come and see me. She had to make sure I could walk properly. The first physio had seen me the evening that I'd had the operation, and I couldn't walk. I couldn't walk with all that gauze stuck inside me, pressing on whatever it was pressing on. I could not walk. She wasn't happy with how I was recovering, which is why they made me stay in hospital. Yeah, the next day came to see me, and I was just basically like, yeah, I can walk. I just want to get home. Just needed to get home. So my husband came to collect me, and I couldn't walk to the car. I couldn't walk properly. So we found a wheelchair, and I just basically left. I still hadn't seen the surgeon at this point. Only the fact that the nurses had been so kind to me and updated me on everything. Oh, and the anaesthetist, it wasn't the surgeon that came to see me, it was the anaesthetist that came to see me the next day, just to check in on me, because he was collecting somebody from my ward anyway, and he just basically said that the surgery went well and everything was okay. Go home once I felt well enough. At home, you can see in my videos I was just so out of it. I was just like a zombie. I was fine. I was kind of up and moving about. I was okay. I think I was physically fit. Even though I was still a mum to a 3-year-old, I was physically fit, but I just advise anybody, if you've got children that young, you really do need the help, or if you can put it off, put it off. But I know from experience that I was in so much pain. I had the operation that I just wanted to get that done. About 7 days, I think, I was at home. I can't remember how long it was. And I was alright, but I still hadn't really gone to the toilet. I think I'd had like a few little episodes here and there where I tried to squeeze something out, but I hadn't really been to the toilet. So the pain that I was getting was in my stomach. You've got to think, if you can think how you feel when you haven't been to the toilet for 3 or 4 days, it literally, it sucks the life out of you. Your body feels really unwell, you feel drained, you feel like you can't function. That's how I felt and more, and I felt so drugged up at the same time. I just wasn't with it. There was one evening that I felt so unwell, got up to try and go to the toilet. I literally just remember seeing right, everything went right, and I collapsed on the bathroom floor. My husband was so worried, and I remember saying to him, and I don't know why, I just remember saying to him, call my sister, call my sister. I knew I needed someone here. I knew I didn't want my daughter to see me in any kind of pain at all. My 3-year-old to see me laying on the floor. So my priority was to get someone here to help look after my baby, and then for my husband to get me to the hospital. I knew something wasn't right, and I felt just so unwell. My sister arrived, an ambulance arrived, baby was taken care of. Actually, my sister that came to the hospital with me, because I think when you've had surgery in those kinds of places, sometimes a woman that's been through childbirth is like a bit more helpful than possibly a man could be. Basically, the nurse said, I cannot believe that they took you in for that operation. I went to a different hospital, by the way. They took you in for that operation and they basically stitched up your bowel. When you go for an anterior posterior repair, it lifts everything back up. Okay, so I think my bowel had come down a bit and they wanted to lift that back up. And where they'd done the stitches or whatever they had done, they had stitched my bowel up. Before my operation, I hadn't been to the toilet properly for a long time, for well over a week. I had this operation for another week, I hadn't been to the toilet. And the nurses at the hospital said, in her career, she'd never seen anyone so blocked up, anyone's bowels so blocked up as much as mine were. In the hospital, again for another evening, I came home and I had everything in place to try and get my bowels working again. I think something, maybe some stitching or something had come undone from the operation, for being on the toilet and bleeding a lot, as in blood clots going into the toilet. There was so much blood that evening that I came and I laid in bed, and I think that was the first time that I had a proper anxiety attack. Everything kept going right, I kind of like I couldn't breathe. In hospital for this operation, I'd already been in hospital because they'd stitched my bowel up, because I wasn't able to go to the toilet, and now I was kind of able to go to the toilet, but I was bleeding a lot. Now, when I gave birth, I bled a lot, so that's another thing I know from all this, is that I'm a bleeder. So if you're a bleeder from when you gave birth and you're about to have this operation, then that's another note that you should take. Possibly, that night, I think the operation came undone. Don't think it worked. So 3 years down the line, I can tell you that that operation didn't work for me. It definitely didn't work. I wish I hadn't have ever had it done. I wish I hadn't have taken the advice of a private doctor to go on and have the surgery with a different doctor. I'd spent all this money with a private doctor for him to assess me, for him to examine me, for him to tell me what was wrong. A few weeks after my surgery, when I went for a consultation, and then I had to go and see him again, and he wasn't even present, it was just 2 nurses. The surgery didn't work for me, I'm healthy, I'm fit, I eat a really good varied diet. I should be going to the toilet regularly. I've got a slow digestive tract, I know that. I'm just one of those people that only go to the toilet maybe twice a week sometimes. I know that now. And that's one thing that was worth the money during all these tests, is to find something like that out and to know it's okay, that's how my body works. And sometimes it is a bit painful and sometimes I do feel a bit crap. But the fact that I had the operation, nothing was done beforehand to prevent all of that pain and suffering and trauma, it's a bit gutting really. Now, 3 years down the line, like I said, that surgery didn't work. I hope from my video you guys have picked up some advice, and I hope that I haven't put anyone off having the surgery if you're due to have the surgery. I just think that ladies need to be more aware of what they're actually doing to their bodies. I think they need to be more aware of their symptoms. Posterior or anterior repair surgery is a really big surgery, like it's a big thing. But it's something that's been on my mind for a long time. Life's got in the way ever since, you know, things happen to people, stuff goes on, family intervenes. talk about it, and I really wanted to give an update to everyone. If you've got any questions, if you've got any worries about anything, please go ahead. Remember, I'm not a professional, I'm not a health professional. So thank you so much for watching today. Please remember to subscribe. I'll see you again soon with another video. Bye.